the first thing is that we have to validate that it's real and that it is earned and that it exists. It's not like, some people's perception of how things have gone. It's not, there isn't a lack of foundation for the perception that people have. There is data to support that. The women, we know about the men of Tuskegee, right? But the women of Tuskegee, they had their children had birth defects. They were sterile. They were impacted for generations to come. Like, this is not just a thing that impacted certain isolated pockets of people. As you said, there's an entire ecosystem that's impacted by racism and bias in healthcare. So I think acknowledging that, and from the perspective of the clinician, we need to show some deference and some respect for that and allow some grace in our conversations with patients. It looks a lot less like, I'm going to tell you what you need and what we're going to do, versus, I know you might not really understand and or believe that I have your best interest at heart, but let me show you how I'm prepared to partner with you. Let me explain to you why these things are the way they are. Let me explain some things about your treatment or your surgery that might help you to understand better why I'm recommending these things. It looks like us taking the reins of our healthcare and our research. I like to say, when we're at the table, we're not on the menu, right? We got Kizzmekia Corbett, who is touted with not inventing but perfecting the mRNA vaccine for the coronavirus, right? So she's doing this work. The very mother of chemotherapy, Dr. Jane Cook Bright, was a Black woman. How many people even know that?
They don't.
The mother of chemotherapy was a Black woman at Harlem Hospital, right? And so I think that we need to own that heritage. And as clinicians, as doctors, and as researchers, we need to help people of color, Black and brown people especially, understand that they have a place and they have a role in this medical ecosystem, in this ecosystem that feels so far and that feels so not trustworthy. Like, there's a seat at the table for you. This table was built by you, and you should rightfully have a seat at this table. And I think that when we do that, that's the beginning of really fruitful conversations that look like, okay, how are we going to move beyond this? What does repair look like? How are we going to figure out what's in our genome so that we can save ourselves? Because that's what it's going to take, I think, for us as a community to believe in the medicine. It's for us to be the researchers and to be involved in design, and for us to be able to say our genes unlock the secret to our wellness. And so I think we're getting there, but that's where we got to go.